we have some of the first models that can demonstrate for certain people sleeping less than 6 hours a night actually changes their blood glucose set point the next day by 20 points. So if you know that, your power is not in the insulin, your power is in your sleep.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Dr. Lisa Shah, Chief Medical Officer at Twin Health. In this episode, we discuss Twin's approach to reversing chronic disease and optimizing metabolism with digital twin technology. Plus, we talk about combining real-time data, predictive models, and human care teams to deliver personalized interventions at scale. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Lisa. Welcome to Fitt Insider. Thanks for joining us.
Thanks for having me, Joe.
Excited to chat today. To start things off, can you just introduce yourself and tell us about your role at Twin Health?
Sure. My name's Lisa Shah. I'm a physician. I'm an internal medicine and pediatrics trained physician, and I am the Chief Medical Officer and Executive Vice President at Twin Health. My role is to oversee all of our clinical programming, our research, our clinical service, which I'm excited to talk to you about today, and our member experience end to end.
And in terms of making this transition, starting at Twin, how long have you been there, and maybe what brought you there, and how's that role evolved in that time?
Sure. I like to say I've been here since the beginning, which is not totally entirely true, but I've been here. I'm going into my sixth year now. And in 2020, Twin Health really had built the model and decided it was time to really embark on bringing this offering, this digital twin technology for metabolic health to the United States and to members in our healthcare system here in the U.S. And that's when I joined. And actually, I love to tell everyone that the first two people on the program were my mother and father, which is kind of a neat, fun fact for me. Both of them with type 2 diabetes, obesity, and really have been impacted by this program in very positive ways. But now we're far beyond patients 1 and 2. So
You've kind of alluded to it a couple of times, and maybe we can dig a little deeper. The Twin Health, it's right in the name in terms of using this digital twin technology, looking at things like diabetes and other chronic conditions now and how that applies. But maybe just what does that technology look like? What does that patient experience look like? And we'll get into more specifics.
Sure. So digital twin technology, take it away outside for a second from healthcare, but it's been around for decades. And the best examples I always love to use are things like self-driving cars or jet engines, where you take really complex systems, like flying a plane, and you put sensor technology. We've been using sensors and machine learning models for decades to make really difficult systems operate safely and predictably. And so if you think about a self-driving car, there are sensors inside the car and outside the car, and they all look at everything that's happening, build a digital replica of that car in the cloud, and can predict things that are going to happen before they happen using that technology and that system. We're sort of doing the same exact thing now with a very complex system, human metabolism. Metabolism is arguably the most complicated system. Believe it or not, more complicated than jet engines and rocket ships that exists. And for a long time, we haven't really been able to figure out how do we understand what's really happening inside the body. So think about the sensors that are feeling and measuring the biological data and changes inside the body with what's happening in our environment, behavioral data. Things that, where we eat, how we sleep, the job we live, the stress levels we have, our socioeconomic status. So we are using digital twin technology to essentially build a digital twin of human metabolism and predict how we can actually heal that system or improve how it functions.
This might not be specific to Twin Health, but hearing you talk about it and thinking about potentially other applications outside of healthcare, and then specifically healthcare, why doesn't all of healthcare, maybe our interactions with doctors, or at least our own well-being, why isn't that based on like just digital twin technology? I know you all are applying it to the specific use case, and we'll talk about how that works and the kind of impacts that it has. But just thinking about it zoomed out as you described it, it's like, don't we just want our interactions with healthcare and maybe our own body to just be, hey, here's the inputs, let's look at them and maybe forecast out what's happening and how we can impact that?
Oh, don't we? Yes, it's a great question, and I look back at my career as a physician, and I feel so fortuitous to be at this moment in time where two things really happened when Twin Health started. Fortuitously for us and our founder, who had a really great idea at the right time. The first thing is sensor technology really improved in terms of how we could actually measure what's happening inside our bodies. We have things like continuous glucose monitors now, activity trackers. Oh, there's all kinds of things, right? From the Oura Ring to the Whoop to Apple Watch to Garmin Fitbit, Bluetooth blood pressure cuffs, scales, all types of things that can measure what's happening inside the body. So that was the first thing. The second thing was the machine learning models and the artificial intelligence capabilities have really just changed, right? And you know, in the last few years, it's even been incredible, the acceleration, right? In terms of adoption of these things, just by the average American or human or person, right? Or individual. So both those things had to happen. Traditionally in healthcare, we have tools, and healthcare is a very, I hate to say it, but it's evolved to become a very transactional business where doctors really have, and clinicians, not just physicians, have a set of tools in their toolbox. And those tools are typically medications and advice. I like to call it medications and advice. And in the world of where you have 15 minutes with a patient, and this is probably the most important part, when we get blood work on someone or we measure what's happening in their body, we're getting a static picture or a moment in time. We're not actually getting a sense of what's been happening to them over the last few months, day in, day out, right? Because it's dynamic, right? When you have COVID, your body's acting very differently than when you're laying on a beach and feeling great and drinking, a margarita. Things are very different in life, and every day can be uniquely different for each person. So we're getting this static point in time. And we've really fallen into, just because of lack of time and lack of advancements in digital twin technology until now, we've really fallen into this model of when you see somebody and you have a few minutes, you look at their blood work and you treat the clinical values, maybe the symptoms if you have the time, and you choose a tool from your toolbox, which is most often a medication. The medication isn't actually fixing the root cause, right? So it's fixing a clinical value, typically. The things that fix the root cause, doctors also try to do, or clinicians also try to do, which is eat better, sleep more, exercise more, stress less. And you get my point. You leave the office and you say, that sounds great. Maybe you do it for a week. But those kinds of aggressive lifestyle changes are not always sustainable. And so we are really just beginning to understand how we can use this data in meaningful ways. And here's the key: in a doctor's world or a clinician's world where we're super busy, how do we arm that accountability in the hands of the member, the patient? How do they see their data? How do they interpret it in a way that doesn't require an MD? And they can actually look at it and say, I know exactly what to do in this moment. And then how do we precisely pinpoint something that's doable and they're willing to do and sustainable for that individual? So that's the conundrum, and I feel like we finally broken the seal on solving that problem. So it's pretty exciting.
Yeah, that is you mentioned there's now an untold number of inputs in terms of data and sensors and everything that we're able to track, and maybe too much of it to the extent that it's like, okay, great, now we have all this information, but what do we actually do with it? And now talking about taking that, how does Twin turn it into actionable guidance and then personalize those things such that you get what you were talking about, is like people are actually willing to make these behavior changes and then stick with them in a way that it delivers results.
Yep, it's a great question. So perhaps the biggest area of advancement for Twin has been, how do you take this digital twin technology? That's just one piece of it. How do you perfectly place it into the journey of a individual in their healthcare journey, right? And so, just to give you a little background, we collect about 3,000 data points a day on our members. Okay, so it's a significant amount of data, whether it's through glucose monitors, activity trackers, and we're collecting sleep data, heart rate recovery. A lot of sensors exist out there, but the first challenge, Twin Health had to solve, or the digital twin had to solve, was taking all of these different disparate sensors and modeling them into a single metabolic model of health, right? And so anyone can wear a glucose monitor and a watch and then say, okay, well, my glucose is doing this. My watch is saying this, but how do they understand those interdependencies and what actually made the watch or glucose, chicken or egg? What came first, right? That's what Twin is doing on the back end. So that's the first part of what we really needed to build and spent many years building, was that ability to take those data points, organize them in a time series, and understand for an individual person which data point was cause, which was effect, and what in their environment or their behaviors, whether it was something they ate or the number of hours they slept the night before, was resulting in that value or that clinical impact, right? So that was the first thing we did. The second thing we realized really early on was data driven solutions are great, right? We see a lot of digital healthcare solutions out there, but healthcare is unique in that human touch is actually still required. Okay. And this was a big insight for us that you couldn't just use the digital twin. The digital twin it's like the 80-20 rule. 80% of the time, the digital twin can tell the member what they need and what to do. But 20% of the time, you need a human. So I'll give you my best example of that. And this is why we have a care team. So all of our members have a coach, a licensed provider, and a care team of nurses and medical assistants and sensor technicians who sort of surround the member for the moment when they need support. So imagine if the digital twin, this entity, sits between the individual and the care team. And a member is sitting at lunch and logs that they had a salad. Now, what the digital twin would do is they could take a photo of the salad, and their twin would say, great, if you eat that salad, we expect you're going to have this glucose spike. And the member says, well, great, I want to eat this salad, and I'm going to put my croutons on it, and I'm going to put my ranch dressing and my fried chicken. And then the twin says, well, now you're going to see this spike, and you have a choice. You can either walk for 15 minutes after you eat the salad. You can cut the salad portion that you're planning on eating in half, or you can actually remove that chicken and substitute it with grilled chicken. Okay, let's just say those are the three choices for you, Joe. And you choose to do 1, 2, 3, or none of those things. The glucose curve will change for you right there in front of you. So this is the accountability. You see this data and you know, wow. So this is the difference between a spike of 200 or a spike of up to 140 or 150. So it gives you power, right? Information and data is power, even, for anyone. But now you eat that salad and then you pull 20 French fries off your kid's plate and eat those, and you don't tell your digital twin. The twin is the power of seeing that something happened because it's been studying your glucose based on everything you've eaten. And it knows that that's not right for what you said you ate. Now, in normal healthcare, a provider or a coach would say, did you really eat that? And then there's judgment. So now there's human to human judgment, which is a really tough thing for people, right? Behavior change is a place that needs to be judgment free. It's very important when people are changing how they behave, right? Whether it's, how you eat, how you exercise, alcohol, right? Your doctor asks you, do you smoke? Almost everyone says no, right? And, or socially, right? And we all know what that means. So now the digital twin can say, did you really eat that? Did you forget to log something? And it's this digital accountability. It's not the care team. Now let's say you weren't able to log for a few days and your twin says, why haven't you logged? And you say, well, my husband's in the hospital. The digital twin actually brings the coach or the care team in and they say, I'm so sorry. And there's this moment of empathy. Now, this sounds so simple, but this is how we build trust with our members. And what we really do is we get them to log their food and begin to depend on their digital twin, log their activity, go for a walk and see the difference in their data, open their twin every day to say, wow, did that walk in the morning or the walk in the evening make a difference for me? And those subtle changes, like those subtle real feedback loops are what move the behavior of our individuals. And that's really one of our biggest insights is that we've really learned to balance human care and human touch when it's needed the most with the digital twin data and accountability and interventions.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. When you look at that on both the kind of personal and then across the user base, member base at scale, what types of, you mentioned a couple of different things. So it's like we're kind of controlling glucose spikes, and we're reversing diabetes or managing lifestyle factors. Like, what are the kind of key outcomes that you look for in terms of tracking, like I said, both on the individual and then member wide level? Like, this is working, this is what we want to see happen, this is like the bounds of like where we know we can improve and control things.
Yeah, so that's great. Great question. So we'll start with the population level. We had a hypothesis a while back that in our early days, that if we did this at the population level, we could actually really move the needle in ways that other interventions out there have not. In two factors. One, the number of people who would actually engage with and stick with the program. So sustainability. And two, the clinical outcomes we would get that would be far exceeding diabetes. And so we did a randomized control trial. Actually, we recently were published in the New England Journal of Medicine Catalyst. And the trial was actually done with the Cleveland Clinic. And this was very important for us. We wanted to demonstrate in a controlled setting, in a true clinical trial setting, that digital twin technology, the intervention of the digital twin with the care team when you need it most, was more efficacious than the usual care at one of the best institutions in the country, right? The Cleveland Clinic. So we started with that trial, and the results were astounding. 71% of the people who were randomized to the digital twin arm, achieved diabetes in reversal, meaning they eliminated all their medications and reduced their A1C below 6.5. In the usual care arm, only 2% of the population actually reversed their diabetes, meaning got off medication and got below 6.5 versus 71%. And in the overall population, we eliminated in the intervention arm 85% of drugs like GLP-1s, okay? So the Ozempics and Mounjaros and drugs of the world. Whereas in the usual care arm, they not only added those medications, they increased them across the board and did not get the same clinical results. So what was really amazing is not only did we improve, obviously, diabetes and eliminate medications and translate that to $8,000 of cost savings and medication elimination a year for the health system or the payer, the insurer. But in addition, on top of that, what we did is we looked at all the other metabolic systems: hypertension, risk of cardiovascular disease, liver disease, dyslipidemia. We looked at insulin resistance, which is the precursor of all of these metabolic conditions. We looked at visceral fat around the organs, muscle mass. We looked at inflammatory markers. And we actually demonstrated that the digital twin technology, because it was fixing the root cause of what was happening inside the body through this sensor technology and digital twin model, all of those systems improved. So we actually, not only did we improve the diseases we set out to, members lost 27 pounds in the intervention group on average versus 12 in the usual care group. So we saw that we were able to have better outcomes across the conditions, but also improve all the existing organ systems. And that do no harm is really important when you look at other things out there: keto diets, fad diets, medications like insulin. All of the tools, yes, they can improve an A1C, but they have other side effects or negative consequences, right? So in keto, we know people were getting cholesterol increases and cardiac events, right? If they ate too much fat. We know with insulin, people get hypoglycemic and end up in the hospital, or they gain weight from the insulin, even though their A1C is getting better. We wanted to demonstrate we could improve all of that and everything else along with it, because this was actually targeting the root systemic changes.
Yeah, you mentioned that the kind of root cause solution, and this might be an overly simplistic question, like hey, why doesn't everything kind of run on a digital twin? Eh, all of our interactions with healthcare, if these are the kind of results that we're seeing, or kind of the potential of the technology, in this case, given the impact in clinically validated and now population level, like, why isn't this the first step? Why are, this is obviously, this is intentionally kind of leading, and that there's a whole lot of incentives and factors and institutions at play in the broader healthcare system. But I guess, what does it take to get to a place where the first step is not insulin, or waiting until after you have diabetes, or having gone on Ozempic or other things, and where there is, as you point out, like, no biological free lunch, like there is downstream effects of any of these things.
Yeah.
How do we get to a place where something like Twin Health is that, like, oh, this is where you go as this intervention, because we can mitigate all the other things that are kind of happening?
Well, I think we're going to get there quickly. I'm hopeful. I think this is just the beginning. For us, it was really important to start on the value proposition, which was, could we actually make people healthier, sustain and show, and just on the sustenance level, people stay in our program. We have less than 1% of people leave us a month, which really is significant. We have thousands and thousands and thousands of members now. Back from the day when it was my mom and dad, it's amazing how far we've grown. Large retail organizations, multiple health plans. And so when I look at where we are today, I think we're just scratching the surface. We've demonstrated we can take cost out of the system. We can build a sustainable solution that has sustainable ROI, and we can create member satisfaction. Our NPS is 85 and above always, consistently. And so member NPS. So we know that we've tackled that. At this point now, it's about scaling the model, building more intervention options. So right now, we just enhanced activity, sleep, and stress. So we started really with nutrition and medications, and really, could we optimize nutrition, at the micro level, so micronutrient level, not just macronutrient level? Could we eliminate medications? And now we're bringing in stress management, sleep management. We have some of the first models that can demonstrate, for certain people, sleeping less than 6 hours a night actually changes their blood glucose set point the next day by 20 points. So if you know that, your power is not in the insulin, your power is in your sleep, right? And how do we make sure you have good quality sleep? So that's like, stress management, meditation, some really basic things that we work with our members on. So we're starting to scale the interventions. What we're really doing now is we've moved from type 2 diabetes to prediabetes and to weight loss. And now we are really building on, what is the new preventive twin? What's the twin that every person on the street wants, gets, their digital twin that actually monitors their health and keeps them from getting these conditions, as opposed to demonstrating we can reverse them. And that's the focus now. And I think, over the next few years, we'll see a lot of development in that area, both, at Twin Health. That's our focus right now. And hopefully someday we will be able to have digital twin technology be the new way of healthcare.
As we're talking about this, it's not like you mentioned, from the first couple members now to many thousands of members. And just to put it into even more context, like, the company just raised money at like nearly $1 billion valuation. So massive in terms of both the potential that people see, and obviously the kind of traction that has already been established. And it's interesting to think about that as it relates to, maybe some companies that are more consumer facing, or a wearable company, or an app that probably doesn't have the impact, probably doesn't have the outcomes, probably doesn't have even the scale, or valuation, if you want to put that number on it. How has Twin kind of approached, you talk about now wanting to scale, going to prevention. Has it been primarily employer benefit, health plan, direct to consumer? And that, like, what is the main barrier to to scale both the impact and then in terms of like, hey, getting to this place where this is more of what the healthcare system looks like?
Yeah, I love it. So our CEO likes to always say we are not a hobby. We are a legitimate healthcare service. And we have always been a legitimate healthcare service. We don't use contractors for our providers, our care team. Everyone is employed by Twin, and everyone is licensed, everyone is trained. And we really believe that we came into this with a mission to improve quality, experience, outcomes, and cost. And direct to consumer for us would not have achieved that. So we have always been value-based care to date. Doesn't mean we don't want to do that. We do want to do that. But the problem we needed to solve was a healthcare crisis in the United States, and a massive one. And that's my background and training. That's our CEO's passion and mission, and everyone at our organization is focused on solving that crisis. And so we really started with going to the payers, and so employers, health plans, and health systems. And interestingly enough, health systems are offering Twin to their own employees first, right? Because it starts at home, and really understanding that if you can give this health plans, we have several health plans that are saying, let's start with our employees. We bear risk on them. And so employers and health plans have been our focus, and health systems. Now we are starting to think about how can we bring this out into the market in a more meaningful way. We get asked all the time, can I, especially when people lose coverage, right? Because that is one of the challenges when you go to an employer or health plan. Someone loses their job or changes, or there's, the spouse changes insurance coverage. Now all of a sudden they can't have access to Twin anymore. So we do want to be able to provide this solution to people in some way that they can find it affordable. But for us, it's really about when we can scale this and make it, the kind of thing that has really removed cost from the payer side and the current cost of healthcare, then it will naturally flow into it being an affordable option for everyone. And we really believe that that's the next stage. But we started here because that's the problem we wanted to prove and solve, which in some ways is a harder one than just selling a digital technology.
Yeah, 100% harder. You have to connect this to, as you said, your measurable outcomes, stripping out costs, proving that over time that people are adhering to it, and then replicating that. Whereas on the other side, if you, and not to diminish the work that maybe a more wellness focused platform is doing, where you're just kind of capturing and showing this data, and do people use it? How do they use it? Is it referenced? Are they changing their? It doesn't really ultimately matter. And so there is a gap, obviously there. If we zoom out a little bit and maybe put some of this into perspective, you know, I think there's potentially a lot of companies that either aspire to or maybe would claim that they're creating a digital twin, right? Like they have a device, they have some type of integration platform, they're capturing all this stuff, and maybe you're able to upload your blood work or you're able to upload your activity data. Obviously, Twin sits at this place where it's like, okay, what happens on the other side of that?
Yeah.
The behavior change, the outcomes. But do you think we're going to a place where it's like there's multiple versions of a twin and different platforms, and how we piece that together? It will be a choice, I guess, in terms of how that gets pieced together, or I guess maybe how do you see that playing out?
Yeah, so digital twin technology, I should say, in healthcare is used in other places, right? We've seen it in imaging, in radiology. We see it in monitoring of ICUs and complex other, there's remote sensor monitoring, which people could argue has some digital twin technology to it. So I definitely think there are other use cases. The complexity we're talking about is this ability to organize tons of biomarkers. I mean, to the point that actually the learning curve, even for me as a physician, was quite significant. I think most of healthcare in America does not think in terms of multiple clinical biomarkers at once and how they matter differently for each individual. So the challenge we had to really overcome is one of complexity. I think this is important. You look at other digital solutions that maybe create a digital twin of your cardiac health. Like let's say it's an activity tracker, okay? Or of your sleep. right? Your sleep quality. And there's lots of solutions out there that do that right now. It's a little simpler for the human mind to process. So the end user doesn't really need a care team to explain anything to them, because you can really look at that and say, because you're just living in this silo of your sleep. But the second you're asked to think about, how does your sleep impact your weight? How does your sleep impact your mood? How does your sleep start to impact your blood sugar? How does your sleep impact your water retention, your visceral fat, your muscle mass, your bone health, your mental clarity, your mood, your emotional state? Wow, it really becomes complicated. And the more you try to really understand the complexity of a system like that, the harder it gets, even for physicians. So we break it down into a system based approach. That's just what we've done. I think to really see people use digital twin technology the way Twin is doing it, we will have to overcome that translational problem of the human body and all of the different complexities and factors that are probably the reason why those of us who practice medicine have to go to so many years of school, right, to truly understand. But we'll have to overcome that complexity. And I think that's one thing I've really learned working at Twin is that it's a one thing to wear all these sensors. It's another thing to really understand that if you're going to make a choice in life, you can make that, but you have to make a different choice specifically in a different area to support that choice. So if you are going to eat that Chipotle food bowl and it's pouring rain outside, so you're not going to walk, you're going to order DoorDash, you just need to eat half that bowl. Knowing that is what we have to distill 3,000 data points into for one individual. And I think that's what we've got to overcome for digital twin technology to be used in the way that I think about it now. I don't know if that makes sense, but that's, I think, the challenge.
No, it definitely does. I think there is like this fine line between, kind of maybe hype or the promise and then like actual outcomes, like interpreting it, putting it into action, actual behavior change, and then like sustaining that over time. And it is one thing to capture this picture, but it's how full is that picture, explaining that picture, interpreting it, like making sure that it's acted upon, like all of those things are the intricacies that go beyond just this one individual, snapshot in time, I guess.
Yeah,
And
definitely.
that, making that shift now, when you think about the potential of the, you said, hey, even for you it was like kind of a steep learning curve to
Mhm.
see like the impact that's possible. Do you have kind of like an opinion or perspective on like where we will see the impacts of AI, even if it's like just beyond digital twin technology, like where this goes, and separating kind of like some of this hype from like what's actually possible in the near term, at least?
Yeah. So, because sometimes I look at Twin as this complex ecosystem of healthcare. Like we're actually delivering true end-to-end healthcare. And and so much so that we also, like any other provider organization out there, we have to also interface with the PCP of the member, right? Or the patient. So they have their own healthcare outside of Twin, right? And we have to figure out how we work in that system, even though we don't share data, right? Because that's the world we live in. And what do we do when they're in the hospital? And what do we do when they go through a crisis or they lose their job and can't afford to pay for food anymore? I mean, all of these things are real for us. One of the things that I've really started to understand is that the AI has actually really changed the game and how we interact as a human connection sort of service in healthcare. And I'll give you a great example. At Twin, we use humans, but agentic AI has grown so much. So, where in the past, one of the most important things I need a patient to do is wear their sensors. Because if they don't wear their sensors, I'm not collecting any data on them, right? So, we need 3,000 data points. And if you have diabetes, you need to be wearing your continuous glucose monitor. But people are scared to put them on. They don't remember how to put them on. It fell off. We used to have humans have to go and troubleshoot all that. Now we've been able to use agentic AI to troubleshoot those things. And really, at this point now, when a member says, I'm scared to put it on, that word scared is read by the digital twin. And that's when we bring the human. Because, digital twin and AI are going to be great to answer 80% of things or fix 80% of issues. But that's what I mean about that 20%. When someone says the word fear, we need empathy, and we could bring the care team in. I could see applications of that in healthcare across the board. You go to the doctor's office and somebody asks you all these questions about your healthcare and your background and we could use agents for all types of gathering of information so that we could have such a more fruitful conversation when we're face to face with the patient, right? So that's one example. Another thing that I think is so fundamental to good healthcare, and I always like to tell my team, we really put care back in health, is trust. Healthcare is one of those unique, if you think about all the industries that have used digital technology, there's so many. Healthcare is a very unique one because much like flying on a plane, it's very trust deep, right? You don't necessarily understand. Like I personally could not get on a plane and fly it for the pilot, so I'm clearly trusting them. And most people don't have the understanding to take care of their own health or know what to do with a hemoglobin A1C or know that if I take this injection of a GLP-1, that my bone and muscle mass are also going to be lost in that way. Most people don't understand these things. What we've really been able to do is build trust with our members because we give them data and we give them interventions and they see real-time outcomes. And this is important. You see your doctor and then a year later you go back for blood work again, or maybe 6 months and you're like, okay, I'm a little bit better. But it took 6 months and maybe you're not because you didn't take the medicine or you chose not to take the medicine. Here, because we're having people see, wow, every day I'm losing half a pound, or every day I'm seeing my blood sugar curve just kind of start going like this, or today I slept better and I have more mental clarity. We are able to build this trust in the data. And I think that's something we've really missed in healthcare. People have for a long time been scared of technology, AI, data, especially patients, right? And now we're really building what we like to call the trust account. And when you build that, people will stay with something, they'll utilize it, and they'll actually seek more data and seek to understand it. So I think we've really mastered bringing all that together, and that's what AI's done for us in a really exciting way that I never thought possible. Like I always struggled with how do you solve the trust problem, the accountability problem in healthcare as we get fewer minutes with people. We're all working harder. The cost is rising and it's getting harder to access care. And I think that's the promise for me.
Yeah, I think hearing you describe that in terms of like tightening those feedback loops, getting to the kind of outcomes faster, and actually inserting people into the equation, like when it matters to be able to move the needle, like that is, we oftentimes, the conversation gets so distracted with, hey, how do we extend life this, or, end this disease, or all these. Yes, we hopefully maybe someday we solve these big problems. It's like, hey, how do we just get people to like make smarter decisions for their health and like trust their providers and these things. So it's like
Exactly.
checking those boxes will enable all the other things downstream. As we wrap up, maybe we'll get you out of here on this. What's kind of next for you for Twin Health? Is it products, expansion, new services, maybe some combination of those things, or anything we should look out for?
Yeah. So a few things. I think we are very focused on the GLP-1 challenges in the United States right now. Many are, but I think we have gotten to a place where Twin has really been supporting people. I always like to say GLP-1s are not for everyone forever. The challenge with them is you can't get off that train once you're on them. And we've really, thanks to our Cleveland Clinic study and lots of experience with them over the last 5 years, we've gotten to this place where we can really help people with an exit strategy. And we've demonstrated in our data that when we remove the drug, instead of rebound weight gain, they actually lose 3% more weight on Twin a year later and improve muscle mass and get back all of that muscle mass they lost without gaining back any visceral fat. And I think for me, that promise is huge. For the longest time, I've been a big believer that medications have a purpose. They have a place in healthcare, but they don't have the only place, and some people don't want them, and people deserve that choice. And so for us to be able to find a way to offer an exit ramp to people on those drugs, I think has been huge for us. And that's the next year, in the next 12 months, you'll be seeing us do a lot of work and support a lot of organizations who are, we just can't continue to cover this forever for everyone, right? And so I think I'm excited about that. We're really focused on you know, being the intervention that is so much greater than nutrition. I think there's a lot of interventions out there that are focused on diet and exercise. Twin is really focused on stress and sleep. We are focused on diet and exercise, but we believe that you cannot take stress and sleep out of those two things. You don't sleep well, you don't feel like exercising. You're stressed, you might respond to how you eat. Stress eating is a big thing. We're really expanding there, and we actually just had a partnership that we're launching that we're very excited about with an organization you'll hear about soon, a company soon that does activity, has their own videos on meditation and stress. And that's exciting for us because we don't need to be everything to everyone. What we are is your digital twin for everything healthcare. And then finally, I think we are embarking now on a journey for the wellness digital twin, the digital twin that will keep you healthy. And that's what you should be on the lookout for. I'm very excited about it. I think that's something that will come in the, in the coming months and next year, hopefully. And that's exciting to be able to give everyone a digital twin who just wants to live a healthier life and not ever be in the situation where they need twin for diabetes or for obesity.
Yeah, absolutely. We'll be following along. And for anybody else that wants to, is it just website? Where would you point them? Anything else that you want to kind of promote or put out there?
Yes, twinhealth.com, our website. Please definitely check it out and follow us on Facebook, on Instagram, and LinkedIn. And you'll hear all about all the great things we're doing. So
Perfect. We will make sure everything is easy to find in the show notes here. And thanks so much for joining us today.
thank you, Joe. Thanks for having me. I really enjoyed our conversation.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.